I am Dr. Gregory Foray, a medical officer working for the Ministry of Health and Sanitation in Sierra Leone. I got a recommendation by the Ministry of Health and Sanitation in collaboration with the Office of the First Lady to pursue a one-year fellowship course in pain and palliative medicine organized by Krishna Institute of Medical Sciences, deemed to be university. Sierra Leone generally is a small country with 7.5 million people. At the moment, the country does not have any designated center for providing cancer care. Rather, we are basically using the main adult referral hospital for providing services for cancer. The statistics for Sierra Leone shows that we have about 3,000 people who develops cancer each year. 2,000 of those patients will die, and those deaths are basically attributed to the late presentation to the healthcare facility. But the challenge is, even if they would have presented earlier to the hospital, we have limited diagnostics facility in the country, and even if there are diagnostics, it might be very expensive that the patients cannot afford. Coupled with the fact that we also have limited treatment modalities. For the entire country, we do not have any radiotherapy facility, and we have the expertise is mostly absent. At the moment, we have just one surgical oncologist and one clinical oncologist who are currently stationed. The only good thing is we have 2 other colleagues who are currently undergoing training sponsored by Merck Foundation in Egypt. One as a medical oncologist and the other as a surgical oncologist. So those 2 will help boost up the human resource for cancer care in Sierra Leone. Providing care for cancer is like a multidisciplinary team. So with the oncologist, with the oncologist, both the medical and the surgical oncologist, their work should be complemented by the palliative care physician. So currently in Sierra Leone, we do not have any palliative care physician. So most of the patients who present to the facilities very late with advanced disease, with no hope of cure, do not have the opportunity of being seen by a palliative care physician to provide the kind of comfort care that is needed for these patients. So for these reasons, I think the training for palliative care physician is really very important, not only for Sierra Leone, but then for Africa as a whole, because we do not have the kind of sophisticated machines. Patients are presenting very late to the facility. So the gold standard should be improving on the palliative care services of these patients. So we give them the kind of comfort, we improve on their quality of life, and then we are actually able to relieve them of their pain and suffering. So cancer care basically, so before this time, once cancer is diagnosed, it's like the patient has been given a death sentence with nothing basically to do for this patient. So apparently, to change these dynamics, I think, so one of the things that are very much important at this point is to improve on the human resource, the expertise of these doctors, the nurses, and then the physicians to be able to care for these patients. So the critical things that are needed could be the human resource, as well as the infrastructure should be provided, so we could be able to tackle these cancer diseases. My expectation for the fellowship in pain and palliative medicine is to actually gain more skills and knowledge that will enable me provide the quality of care that is needed by my patients, and notwithstanding advocacy as well as training should be on top of my priority. That is not only thinking about the patients themselves, but also helping in advocacy and as well as training of other healthcare providers to ensure that a comprehensive package is given out and my country is able to be saved from this disease of cancer. So with no palliative care physician currently in Sierra Leone, I really hope to be a kind of resource material for the entire country, wherein I will not be only engaged in providing patient care, but to also serve as an advocate for the incorporation of palliative care into the general health care system, because once that is done, we know that will be the first step in palliative care training among doctors. So similarly, training of other healthcare professionals will be very much important, for which I think I can play a key role in that. Because the more we get more physicians, more nurses being trained in palliative care, I think comfort care can be guaranteed for our 7.5 million population. In terms of the general structure of the training, currently, one of the things I will suggest from my experience is to ensure that more collaboration with other centers are being done. So once we have collaboration with other centers, you're able to be exposed to almost all the things that are needed for you to equip you enough to face the challenges that you'll meet in future once you get back or once the training is complete. So the new batch of students who will be aspiring for a fellowship in pain and palliative medicine will be, first of all, to consider palliative care not as a less lucrative specialty, but to consider it as important as all other specialties. If you currently consider the type of disease dynamics in our countries, you'll really put premium on the importance of palliative care. Therefore, taking this opportunity to be trained as a palliative care physician will put you in a better footing to be able to provide a comprehensive care for the patient. So you look above just the disease condition, just above the symptoms, but then you consider the patient on a holistic perspective, wherein the physical, the psychological, and the spiritual aspects of the disease are also taken into consideration. And honestly, what will happen is that you'll notice that it will be very much fulfilling, because you are actually adding value to the lives of these patients who are already dying. And you continue to be in a journey with the patient until the last minute of their life. So it's kind of so fulfilling. So I want to encourage my colleagues to really see palliative care as a new field, new emerging field that is very important as cardiology, as important as nephrology and other fields in medicine. So to Merck Foundation Oncology Fellowship Program, I must say thank you very much for giving me this opportunity and for giving this opportunity to my country that was in dire need of such an important specialty. So I thank them very much for the expertise and the knowledge they've impacted in me so far. Sierra Leone.